Menses changing dates is not a problem. It is not compulsory. I mean, it is not mandatory. You must see your menses on a particular date every month. So if you're seeing your menses on different dates in each of the months, it shouldn't be a problem. Don't give yourself high blood pressure as a result of that. What you should be concerned of is your cycle. Now, if your menses comes on a different date in any of the month, what you should do is to count your cycle length. Is your cycle length less than 21 days? Is it more than 35 days? It is only when it is less than 21 days and less than 35 days that you should be concerned. But menses changes dates. It is normal. That is normal. Though some women may be lucky to be having it on a particular date every month, but if your message doesn't come on a particular date every month, it shouldn't be a problem. It is a normal thing. It happens. Okay? So don't stress yourself over that. Bye. You have just missed your period and you're looking for a way to get that message back. Now, do not be in a haste to take that herbal concoction they have asked you to take, thinking it will help to bring back messages. Before you take those herbal concoction, I need you to do these 5 things. Doing these 5 things may help bring back that message. Number one thing you should do as a young girl, as a woman who is trying to get pregnant, whenever you miss your message, the first thing you should do is to take a pregnancy test. Yeah, take a pregnancy test. Let's know if the actual cause to that absence of message is as a result of pregnancy. If you have taken a pregnancy test and the result comes out negative, you move to the second stage. This is where you have to wait a little, okay? Because there is always a point in a woman's life, the woman who has had a regular message, a point in her life that her message can just abruptly or suddenly cease. It is called secondary amenorrhea. Now, during this period, you're waiting for this message. You have to look at your lifestyle and look at the things you are not doing right. Number one thing you should do is to manage stress. If you're the type that is involved in a chronic stress, this is the time to manage that stress. If you just started an exercise and that exercise is strenuous, you have to go in for mind exercises, okay? And even if you're the type that doesn't exercise, you're not active, you have to engage in mind exercises, okay? And you have to eat healthy, eat more of fruits and veggies at this point, increase your fluid intake and prioritize sleep. During this point you're waiting, you're doing all of this. If you have waited for 1 month, 2 months, 3 months, and this message hasn't returned, you move to the third stage where you need to go and see a gynecologist. Now you're seeing a gynecologist for the gynecologist to identify the cause to this absence of message. While you have seen the gynecologist, after some series of investigations and examination and history, if the cause has been identified, you move to the fourth stage, which is the treatment. Now, the treatment will be given to you based on the cause. And after that, which is the fifth stage, at this fifth stage, whatever medication instruction your doctor has given to you, my darling, follow that instruction, follow the medication. Do not go back and start taking the herbal concoction again because you might just spoil things for yourself. Follow your doctor's instruction and take the medication completely the way your doctor has asked you to take it and see how your message returns. I hope this was helpful. Bye.